I would also like to talk about the continued excitement about intrauterine treatment for lysosomal diseases. This work was presented by Dr. Sarah Young from our group, but I also did it in one of the satellite symposia, talking about the benefits of earlier treatment. And we definitely have newborn screening, which is a great step forward, but the ability to treat even before a baby is born because disease has already started. We know this for some of the rapidly progressive lysosomal diseases, including Pompe disease. And our little one, who was the first who was treated, who is CRIM negative, which is at the most severe end of the disease spectrum, is now 23 months old and doing really well. With from a really important perspective, she's behaving like a typically growing little girl, but also that her biomarkers, which are very reflective of ongoing muscle damage, have remained in the normal range. So very promising, but of course we have to be guarded and continue to follow these children long term.